3 easy stretches for low back pain.
You simply rotate. Now notice my shoulders are glued to the table or the floor, and my knees stay together gently. I'm not contracting tightly, and I'm rotating with a nice motion to the hips actually leave the bed here, the platform, and we're going to go back and forth 10 times just to get the low back, the muscles relaxed. You're getting some motion in the facet joints.
What happens if it hurts one direction?
Excellent question.
Bob.
Let's say I go to the right, ow, and I get pain to the right. Well, do not push through the pain and think you're going to crack your back and it's going to be all better. We're going to bump to that point and we're going to stop going into that painful range, Bob. And then we're going to go back this way, and this way maybe feels better. And then we're going to go all the way over, get the motion here, come back, allow the pelvis to go flat. Just bump. When you start to feel that painful spot, stop right there and then go back. And now I call it, with my patients, I will say it's like a windshield wiper.
Now you can vary a little bit where you put your feet to. You can go closer to you,
yeah,
or further away,
right,
and see how that affects your back too.
That can make a big difference
It
too.
can.
You know, just some of those little.
Now,
curls.
an advanced version of this would be to come over this way, Brad, and then actually let this one go out further
Right,
like that.
Exactly. I could do it this way, but I bump into that.
Right.
Yeah. So if this feels good, well, go ahead, give it a little more.
That's an advanced version.
As long as it feels
right.
good.
It would start you. You could do the prone prop.
Yeah.
Just up on your elbows, or you could start off hands underneath the shoulders and do micro press ups.
Yeah. But with the McKenzie system, he does promote the actual movement,
right,
up and down,
and getting way up here even,
yeah,
possibly. So if the movement is making it worse, you're going to stop.
Right.
And we're talking about after too, like the next 24 hours.
Right. Yeah.
But with Stuart McGill, what he would start off is kind of like this, and then he might even go up onto your fist,
kind of a progression.
Yep. And then you go up to 2 fists.
Sure.
But he would just have you lie here. And, eventually see how the back does with just gravity.
It's a great way just to get some nice non-weight bearing range of motion through the lumbar spine, which Bob is doing a nice job of.
A lot of people can do this one. So you bring the arch back up like this, and my head comes down.
Yep, look at that.
And then I go the other way, and I bring my head up.
I do want to mention, I know Dr. McGill oftentimes says, make sure your knees
are farther apart.
Right, farther apart, shoulder width, gives you a wider base, and it stabilizes the pelvis. And he mentioned a few other complicated things I can't remember. But it made sense when I was reading it.
Right.